EGM Network.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor.
Good afternoon and welcome to Community Conversations. As I listen to the intro and talk about how we'd be a poorer community if it weren't for Treasure Coast, I have to honestly expand that and say we'd be a much poorer community if we didn't have so many of the various service organizations, nonprofits that are serving members of our community. It really makes us who we are. But again, like lights under bushel baskets, as the old country saying goes, a lot of people don't understand or know about the great resources that we have in our community or the deep need that most of these nonprofits have. We were just talking before we started about financing and how there's no money trees in our backyards, but we keep going and doing what we need to do. So it is with great pleasure that I'm here today with the leader of the ARC.
It's a pleasure to be here, Vicki.
Absolutely. So Heather Dale, I'm sorry I didn't say your name right out of the get-go, but you have been a leader in this organization for how many years now?
I've been the CEO for 6, but this is my 25th year at the organization.
Wow. I guess I don't have to ask you how you came to be the CEO. What attracted you to the ARC in the first place then?
Honestly, it was a wonderful opportunity. I was taking an overnight job to pay off a student loan.
Oh, my goodness.
So it was just an opportunity to do something I liked and did before up in Ohio, and I enjoyed it.
So when you first came, tell us what the ARC looked like at that point.
Wow.
That would be in 2000.
It was January of 2000.
Okay.
And we had 5 group homes, and in between then and now, we closed one and we've opened 2. And we had a very large day program and a lot of work projects in the community. And that has titrated off with federal legislation because peace work is not really something that federally it's positive. And
so for people who don't know what the ARC is, why don't we back up even more and we talk about your mission and the kinds of folks that you are intended to serve?
We work with people with special needs, primarily adults, transition age on a small scale, people with intellectual disabilities, autism, cerebral palsy, spina bifida, Down syndrome, and we provide a continuum of care.
And that's why the group homes especially.
So we have group homes, we do day services, we do door-to-door transportation, as a lot of our individuals are not able to use senior resources, Go Line to navigate. We partnership with them. We offer behavior services because some of our individuals do not have appropriate social behaviors. So they channel,
very well said.
They channel how we feel, but they display it. Mm-hmm. We have a supported living program for people who live out in the community on their own and just need a little bit of assistance, like banking, helping with doctor's appointments, and then supported employment where we help people of all disabilities, whether it's intellectual disabilities, it could be people with mental health issues, paraplegics, I mean, you name it.
I didn't realize that.
In finding and attaining jobs, competitive employment in the community.
And it is competitive. So about how many people would you guesstimate you and your board members help each year?
Annually, we service over 200 people. Daily, it's around about 100. So
that's quite a challenge.
It's like your organization where it's continuous and it's always has challenges because it is in social service network. Mm-hmm. And
but the rewards are so great.
It's fantastic. I mean, you're watching people have so many wonderful skills, develop skills, be independent, be part of the community, and that's what we're here for.
And when I think about the family support, that's got to be huge. often Down's syndrome happens to couples later in their lives. And so that's a perpetual joy and worry that I've experienced with others.
It is. And it's a little bit of a challenge just for the mere point of fact. Parents always are concerned what's going to happen next.
Mm-hmm.
And as
we all are,
whether it's somebody with normal cognition or somebody with a special need. And people with special needs, parents delay the transition piece because you're worried, and it's finding the right place, what you want to do, the right supports.
Right.
And so transitioning doesn't happen fast, which is fine. But it's finding a good transition, and that there's going to be some place for their loved one to be and taken care of, and that there's continuous supports, because there's always a worry what the next step's going to be.
Absolutely. So are you able to meet with parents as they're approaching those decisions, and or some of your day programs? Is that an intro to some of those lifetimes of trust?
It is, and it's very important because it's letting people know that there's services out there. Mm-hmm. One of the biggest obstacles that we run into is people don't know, because they go to school, that's paid for. There's a system called the Med Waiver. You're not automatically signed up for the state program. People have to sign up for it. And I just got the updated numbers today. There's 21,000 people on the pre-enrollment list in the state of Florida. Wow.
So that's years
it's
to sit on a list.
10+ year list. They no longer call it a wait list.
Oh my.
So talking to families when they're in school is very important, because they're eligible to be on the waiver at age 3.
Oh.
So it's once they're on it, it's from 3 until.
So if you anticipate that most of our children stay at home through high school, 18, 19, many past that, but at a minimum kind of drawing the line, it would not be unreasonable to get them on a med waiver, because according to your statistics, another 10 to 12 years.
It's at least.
Wow.
So having that conversation with family when their loved one is getting ready to graduate school and they're not signed up on the waiver, we help people sign up several times a week. And we do offer services at a private pay rate, which we just do the state rate that we're reimbursed, which is a Medicaid rate. So it doesn't cover just like your Medicaid.
Yeah.
But just to actually say, here, there's opportunities, and having those discussions to say, these are things you can do now or in the future, or even if you're not wanting to use the services that much presently, you're going to want it and to have access later, because residential services is a 24/7. And while it's not as much as like elder care and what the rates are, it is still not something that's inexpensive out of pocket.
And yet I really feel for a parent who you might be approaching with a 3 or 4 or 5-year-old who are just really kind of wrapping their head around the way the rest of their future is going to look. And you're asking them to jump ahead by some 15 years.
And honestly, if you back up to that age, families are just trying to make ends meet, have time, figure out therapies and services to help, because early intervention is one of the best things that can happen in quality of life and any aspect. Absolutely. So that is a huge piece, let alone worrying about step.
Exactly.
So those are things which is,
So I know that your organization would love to talk to anybody at any time, because that's who you are, obviously. But I wonder if there are people who are listening who are what we used to call shirt tail relatives, okay? Those that aren't involved in the day-to-day, but have a caring relationship with other people, whether they're officially related or not, that could help broach that conversation, hearing ours with others.
That is, we do receive people who call to say, I know of a family member or a loved one. I've been trying to talk to them. Are you willing to, broach some of, because these are not
Easy
topics
conversations
that anybody
Mhm.
really wants to have.
Right.
And it's not anything other than just relaying information and in a
No decisions
positive,
necessary,
right,
but
it's a non-threatening, just these are options, because if you transition now, there's a transition. It's better than waiting until there's an emergency, a need. At that point, it's too late.
that's
So
a scary thought.
But
knowing you, I'm sure you make yourself available at no cost anytime people want to talk.
we have myself, we're fortunate because we have a lot of our management team has been there for a long time, so they understand the process and, just how to walk things through. And then in addition to our services, there's a huge network for special needs and access. I mean, it's about relaying what else is out there. And social isolation for people with disabilities happens just because the access to transportation, it's not as though they can't access the GO line, but it's a challenge because networking the system. And so just being able to navigate what else is out there for friends that they can have social, from special equestrians to youth sailing, they have a program. There's
right. They expanded that.
Mm-hmm. We have some of our people go to their program. We partner with Kiwanis. They do a dance. We let them use our facilities. So, I mean, there's a lot of.
I was going to ask about that.
We do a lot of other pieces and in our social network to try to,
And that's why you have about 100 people every day that you're interacting with.
That's just our day. The other stuff is ancillary. That's just our 100 people is our core program.
Okay. And I know you have not recently, you have been working with Sunshine Physical Therapy as well. Again, sort of expanding those barriers and making more convenience for the folks that are directly under your umbrella.
Well, we're trying to continue to offer more and more services and therapy services. Maintaining people's health is a big piece, and whether it's gait issues, fine motor skills, and Sunshine Therapy has a great
team,
great therapist network. So what we can do to help our individuals stay healthier and use very professional services is even better.
I'm so glad you mentioned all of that. We're going to take a short break, Heather, and we'll come back for a word from our sponsors. Thank you. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
Create your island paradise at Sunshine Furniture during our winter sale event. Save 50% on all Tommy Bahama and Lexington, including the newest collection, Key Biscayne. Living room, dining room, occasional chairs, office, and media furniture with sophisticated design and a mix of coastal and Caribbean style. All Tommy Bahama and Lexington offer everything you need for your Florida living. We have the largest selection of in-stock coastal furniture from Four Seasons, Capri, Universal, Riverside, Hooker, Seawinds, Barcalounger, Best, and lots more. At Sunshine Furniture, we're the outdoor furniture experts specializing in patio sets that withstand the Florida elements, and we have a gallery of Berlin Garden and Bollywood. Come in now for the best prices of the year. Sunshine Furniture, $12.95 US 1 in Vero Beach. Don't miss the 50% off winter sale on Tommy Bahama and Lexington going on now. Visit our website at sunshinefurniturecasual.com and visit our outlet store directly across the street.
Are you opening a used car lot, pawn shop, a restaurant that will serve beer and wine? In the state of Florida, these and many other industries require a Level 2 live scan background check for clearance to work in your industry. A1A Fingerprints is your certified live scan source from Broward to Brevard.
card.
And if you're a medical provider, you need to be registered on the ACA web portal. A1A Fingerprints will help you navigate and comply with the law. Call 772-494-6556 or visit a1afingerprints.com. A1A Fingerprints.
And welcome back to Community Conversations. If you're just joining, my name is Vicki Soule. I'm the CEO of Treasure Coast Community Health. And apparently I can't say no. We were just talking about how many things I'm involved in. I obviously am a type A that's very, very interested in seeing our lovely community be the best that we can be at all times by involving others. And so I can't just sit back and give directions. I have to be right in the thick of things. So today, one of my past colleagues, she loaned me space at her building. So when I say past colleague, I do mean close and up personal. So thank you, Heather, for
You're welcome.
The loan of your wonderful classrooms for our board to meet in. We look out for each other. We have to in this community.
Well, nonprofits are important in helping each other out, and anything we can do, it's a good thing.
Absolutely. So thank you again. The break we had was very short, it seemed, but you whispered in my ear, your 50th is coming up.
So we're on, ARC turns 50 this year for Indian River County, and very excited about it. And it's been, I was looking back at all kinds of pictures and buildings and history. So we're excited because we're going to do a celebration on April 24th, and we're sending out invitations in the next week or so, because our pavilion, which is we've talked about construction,
We have.
and
construction delays,
occasional quirks that happen with construction, and our pavilion is finally being erected this week, and it's going to be
exciting.
I'm like ready to just do backflips.
Yeah.
And I told a few of our donors we're going to put streamers and fireworks when it finally is. It's been a 3-year project. So, but we'll be able to use that and for our
all we need
celebration.
now is nice weather.
Well, I can only hope.
Pavilions have got a roof.
Right, it's
so
got a roof.
Yeah, how
and,
bad could it be, right?
We'll
get everybody out there early.
Have tents set up, and so we're excited. April 24th, which is a Thursday, and we will be able to have a party 5 to 7, and I'm excited.
You have a house that is right on campus?
We have a house on campus, and it's behind our large day program facility. So we're excited to be able to do it there and be able to hold events and allow our facilities to be used by our individuals and other programs.
Any historic speakers? Any other parents or?
Well, Mary Ellen Rapogel is she turns 100 this year.
Oh my gosh.
And we've talked to the Rapogel family about Mary Ellen being able to be there. She's one of the last, actually she's the last founder who's still alive.
Yeah.
And Harry Hurst, who was a prior executive director, is 92, I believe. And he's
coming?
He's going to be coming.
He wouldn't miss a party.
Right?
Yeah.
And Reese Brackens, who's been on our board off and on for years, he will be in attendance. So we've got some very longevity people, supporters in the organization who we've already reached out to quietly, but we haven't, like I said, really actually announced the date. We're getting ready to send the info out. So this is more announcing than anybody even on our board knows, because we've just firmed up the date because we needed to make sure the pavilion would be done.
Yeah. Kind of hard to throw a party and not have a
location.
Yes.
Right.
Yeah.
So we're happy about it, though.
Oh, that is wonderful. And I'll bet your staff and your residents are also equally happy.
Oh, everybody's happy. And it's going to be a blockbuster back part of the year for celebration, and just finding unique ways to remind everybody where we've been, but where we were going and what our organization has to offer. So
you've talked about adding services. Do you have a crystal ball in terms of your goals for the next couple of years? Now that the building's going up,
well,
the pavilion,
the services. We're looking at probably in the next few years, we'll add another group home or look at adding another group home, trying to figure out how we can do that on that campus space, trying to work around federal legislation. And if we can do that,
Maybe they'll just eliminate that old law.
that line item.
Yeah.
Okay.
Yeah. They're doing a lot of that. So be optimistic.
I will. I mean, there's some other things we've quietly talked about. One area I really want to focus on that's important to me, what we were talking about previously, is advocacy. I'd love to add an advocacy position to do a lot for talking with family members in the community, and just educating, running some work groups for trusts, wills, so people understand more about that piece, guardianship, because once somebody turns 18, even if they have a disability, they become a
legal adult,
capacity or not. So those are all things which I find very important, just from an education standpoint. So having an advocate on staff.
I hear a volunteer opportunity part-time if you've done some of this in the past. And would like to have some measure here. Even if you're not a 12-month resident, I would imagine it's still very helpful.
Oh, it'd be very helpful. We have volunteers to help us go out on community outings, an extra set of hands. We can't replace our staff. All we can do is augment our services. And so just having, we have a few volunteers who help with us going on outings, just so there's another help of hands on pushing a wheelchair, or we're going to a baseball game on the 17th. And so we've got a whole group of people who are excited to be going to the Mets game. So just fun stuff.
Fun stuff. Yeah.
Yeah.
And when we were growing up, everybody encouraged us along the way to volunteer. Okay. That now they've, I guess, memorialized that into some of the high school requirements. Okay. But I'm not sure that the people at ARC are necessarily thought of as a volunteer opportunity. And as you say, it really is an extra pair of hands. It's somebody to talk to. I don't want to say no special skill sets required, but it certainly suits a high schooler.
It's something that's very beneficial because it's a part of the community. You don't have to have a set of special skills to just sit and have a conversation. And that's all it is. It could be playing cards with somebody. I mean, we have people who love to play cards. Bingo is a big favorite. I mean, it's just spending
some time.
It's treating people just how you want to be treated and having a normal conversation.
Yeah. The biggest difference is they don't have the mobility. Most of your clients do not have the mobility or the skill set to navigate around as freely as our teens do.
And
but they're regular people.
They're regular people, and they might not have the same social
graces.
Social graces. Or, great story I love to share. Somebody who moved into a group home that I started working at so I've known her for 25 years. And she really wanted to talk and have a conversation, but she doesn't understand or watch a lot of news. So small talk is not something she understands. So helping her learn small talk of just asking some simple questions. What did you have for dinner last night? So now she has a repertoire, which is longer than I am tall, but it's just having conversations, but you don't know what you don't know.
Exactly. So that is a great example. And I hope that we have some folks out there that say, I could do something like that and improve the community that I live in and improve the life of that particular individual that I might be paired up with. And I suspect that you would rotate anybody around that wanted to.
We have people who volunteer with cooking class, and we have people who volunteer with dance class. It's just there's all types of opportunities, and we have people who want to volunteer but not really help in the classroom, which is fine too. We've got all kinds of opportunities.
There you go. So that wraps us up for another 30 minutes. I hope that this has been a valuable insight to you into another aspect of our community. And again, you're never too young or too old to volunteer. So think about it and have a great week. See you next week.